One feature of repeated movement testing that I really like is that at its core, we are asking, as a result of doing this one motion repeatedly, are you worse, better, or about the same? And that's typically how I phrase it with patients. We're looking for an overall change, symptoms and signs. But from the patient's perspective, I'm getting a report on symptoms, frequency, intensity, location, functional ability. And so I really want to know, are you worse, better, or about the same? And if they're hemming and hawing, or I think I'm a little bit better, then to me, that is about the same. I want it to be a clear distinction that the person is like, oh yeah, I'm better. Or yes, I abandoned the exercise like you told me because I started to feel worse in this way. And I will corroborate if that is indeed worsening. My job as a clinician is to get a little bit more into the details. I need to think about centralization, peripheralization, possibly localization of symptoms. I need to understand if the symptoms match the movement that we're doing, or if they could possibly be coming from something else that's just moving in a new way and not related to the possible mechanical joint derangement that we're investigating. On the objective side, I need to understand as a clinician which objective findings are most important, which range of motion is relevant, which, how much nerve tension should we be seeing change, how much should I see change in terms of strength or other objective baselines. But keeping it simple for patients in terms of the subjective report, worse, better, about the same, I think is really key. I joke with patients a lot of the time that they'll say, maybe I'm a little bit better. I say, if I hear 2 qualifiers in a sentence, you're not better, you're about the same. And we need to keep in mind that this question is so essential because joint derangements can change quickly. Unlike tendinopathies or muscle strains or ligament sprains, or of course, structural problems, anatomical problems that are symptomatic, those are not going to change in minutes, hours, or days. Joint derangements will. For the people on one end of the spectrum that are younger, no comorbidities and acute problems or subacute problems, I'm expecting that change to happen in the office. I'm expecting to see that 20, 30, 40 repetitions of the repeated movement I choose have a beneficial effect if it's the correct movement, or a worsening effect if it's the wrong movement, or sometimes movements can be ambiguous and have no effect. For those on the other end of the spectrum, it may take days, but I'm typically seeing something, or almost always seeing something in the clinic that is, if I'm looking for a motion that I think would be fruitful, I'm seeing something change in the clinic. Better range of motion, better strength, less pain with range of motion, slightly less nerve tension that makes me want to investigate it over the course of 48 hours. But patients, I try to make them think that it's not their job to really think about, is it a little bit better? Is it a little bit worse? How has this symptom changed versus this symptom changed? I just want the overall picture. Are you noticing better, worse, or no effect? For patients who are worse, I've instructed them beforehand, I want you to do this one motion over the course of several days. And if you think to yourself, Laura gave me this stupid exercise and everything's getting worse, please stop. That is definitely more intel for me to help me arrive at the right diagnosis, because at the end of the day, repeated movement testing until it's obvious it's the fruitful motion is testing. And that type of testing is different than other orthopedic testing, because I believe repeated movement testing means repeated. You need to do it over the course of several days to get the real answer. Sometimes patients have no effect with 40, but you ask them to do 200 or 300 over the course of several days, and then you get your answer. But big picture, this is a big picture question where we start with to understand if the movement is fruitful or not. We just ask patients, and we ask ourselves as clinicians when we're looking at the entirety of the problem, is the patient presentation worse, better, or about the same? And we go from there based on the answer.